Good afternoon. Thank you for joining us for today's event, Federal Aid and the Recovery from the COVID-19 Crisis. I'm Anne-Marie French, Executive Director of the New Hampshire Fiscal Policy Institute, an independent, nonprofit, nonpartisan policy research organization based in Concord. It is my pleasure to welcome you to today's event. We are delighted to have so many attendees from all across the state joining us for this discussion. Today's event features a two-part presentation from NHFPI staff, which will review the impacts of the COVID-19 economic crisis and the coming federal aid through the American Rescue Plan Act. This will be followed by a panel discussion highlighting how this federal aid can support efforts to ensure a strong, equitable, and inclusive economic recovery. Our guest speakers for today's panel discussion include Katie Easterly-Marte, Executive Director of the Community Development Finance Authority, Will Arvello, Director of the Division of Economic Development for the New Hampshire Department of Business and Economic Affairs, and Carrie Gladstone, Senior Director of Asset Building Strategies at Granite United Way. Our panelists will participate first in a moderated discussion, which will be followed by an audience question and answer session. We encourage you to submit your questions throughout the event using the Q&A function located at the bottom of your screen. This webinar is being recorded, and links to the recording and the presentation slide decks will be posted to our website following the event. We'll also share these links with you via email, so please watch your inbox for these resources later this afternoon. Our first presenter today is NHFPI Policy Analyst, Michael Polizzotti, who will review the impacts of the COVID-19 crisis here in the Granite State and how residents were faring prior to the onset of the crisis. Following Michael's presentation, NHFPI Senior Policy Analyst, Phil Sletten, will review the federal aid available to the Granite State through the American Rescue Plan Act, also known as ARPA. As we know, it can be a challenge to see the slides on Zoom. We will also share a link to their presentation deck in the chat, so you can follow along on another device if that's helpful. And now it is my pleasure to introduce our first speaker, Michael Polizzotti.
Right, thank you, Anne-Marie. Let me just share my screen. And so good afternoon, everyone. And thank you again, Anne-Marie, for your introduction. My name is Michael Polizzotti, and I'll be giving the first presentation in this webinar where the focus will be centered on some of the economic impacts of the COVID-19 crisis. So we've seen some profound challenges to the health and economic well-being of many Granite Staters over the past year. And we've also seen severe employment impacts along with disproportionate effects on different groups. So we can start by looking at the estimated levels of unemployment. And we can see a large spike as a result of the efforts to control the pandemic in mid-2020. And these elevated levels of unemployment surpassed what resulted from the Great Recession. And we can see that in this graph here with the blue line representing New Hampshire's monthly unemployment rate estimates back to 2007, and the green line representing the nation. Now, these estimates have declined significantly from those peak levels in mid-2020 and are nearly back to pre-pandemic levels in New Hampshire. Now, the number of people in the labor force has also declined, as did the number of people actually employed in the state. Labor force levels in the state on this chart comprise of the number of individuals who are working or those who are unemployed and actively looking for work. So both the labor force in New Hampshire, which is shown on this chart by the blue line, and employment, which is shown by the green line, are still below pre-pandemic levels, even given the recovery we've had thus far. Now, one other important point to mention is the difference between the recovery of the official unemployment rate shown in the last slide and the fact that the labor force and overall employment have not fully recovered. So the official estimated rate of unemployment only factors in individuals in the labor force, so those who are actively or very recently were actively looking for work but haven't found employment. In its calculation. So because of this methodology, the smaller labor force we have now may be contributing to some of the declines we've seen in the unemployment rate, which may not be indicating a more complete job recovery. So given those indicators, there's also been an overall drop in the employment to population ratio. So this metric measures the percentage of the population that has a job in New Hampshire. And it currently sits at about 65%, which is about 2 percentage points below pre-pandemic levels of 67%. And transitioning to the county and industry employment impacts, we can see that there were different, different geographies in New Hampshire experienced different employment impacts. Service-based industries were most affected by these employment losses, and industries paying lower than average wages experienced some of the largest declines in the state. So when looking at the county level estimates of unemployment, some of the largest impacts were in more rural regions of the state. So counties like Carroll County, Belknap County, or Coos County. And this may be attributed to the composition of jobs in these regions that may rely more on physical interactions, tourism, or other service-based industries that weren't able to adapt as quickly to a model that limited in-person interactions throughout 2020. And also looking at the breakdown of unemployment insurance claims over the last year helps to signify the employment losses and also show which industries may have been most impacted in the state. So by looking at the distribution of unemployment insurance claims by industry, this chart shows that since the pandemic began, significant portions of unemployment insurance claims were generated by industries that paid lower than average wages. So this chart shows the 5 industries that generated the most unemployment insurance claims from March 16th, 2020 to March 20th, 2021. And the blue bars represent the number of claims in that respective industry, their initial claims generated, and the green bars represent what the average wage is in that industry, with the horizontal green line representing the average weekly wage across New Hampshire in 2019. And here we can see that food services and drinking places, administrative and support services, educational services, and social assistance all paid lower than average wages. But were 4 of the 5 industries that generated the most claims. So this indicates that large portions of the job losses in New Hampshire and the losses in employment income were more acutely felt by lower wage workers. And other analysis shows similar findings as well, that the largest employment losses were in lower wage industries. So this analysis from researchers at Harvard and Brown universities show that lower and middle wage employment in New Hampshire saw some of the largest declines as a result of the pandemic. And these jobs in lower and middle wage work, which are represented by the dark blue lines and the teal lines, haven't recovered to pre-pandemic levels in New Hampshire. But notably, higher wage employment, which is shown by the red line on this chart, recovered fairly quickly and actually has grown in New Hampshire when indexed to January 2020. So the uneven impacts across industries and jobs has also resulted in more acute impacts for different groups of people. So the labor force and employment has declined nationally and in New Hampshire, and more acutely for women, especially women who have younger children or may have childcare duties. And nationally, levels of unemployment lasting longer than 27 weeks have been rising. There are higher levels of unemployment for non-white or Hispanic workers and those without higher education. The percentage of workers employed part-time involuntarily due to weak economic conditions or slack business conditions are still elevated compared to pre-pandemic levels. And the labor force participation of women declined more and has recovered less than the male participation rate as well. And we can see some of the data visualized here by comparing the relative changes in the employment to population ratios by racial and ethnic group and between men and women between February 2020 and February 2021. So here the green bars represent men identifying as white on the right, Black or African American in the middle, white on the left, Black or African American in the middle, and Hispanic or Latino on the right. And the orange bars represent women identifying in each of those respective groups. So those identifying as Black or African American or Hispanic experienced larger declines in their employment to population ratios compared to those identifying as white across the country. And the largest declines across all of these groups were experienced by women. So given what we know about those disparate economic impacts of the pandemic, it's important to remember that many of these groups who were most affected by the pandemic were already facing economic disparities in New Hampshire before the pandemic began. So using the most recent estimates from the American Community Survey, we can identify several points. So this chart shows that prior to the pandemic, Median household incomes, as shown in green, and per capita incomes in blue, were lower for households and individuals identifying as Hispanic or Latino, Black or African American, or two or more races in New Hampshire. Now, these same data also showed differences in poverty levels based on different factors as well. So those same individuals identifying as African American, two or more races, along with children and those with lower levels of education and part-time workers, all had higher levels of poverty in New Hampshire before the pandemic began. So just as an example, the estimated poverty rate for Granite Staters identifying as Black or African American was between 2 and 3 times higher than the state overall before the pandemic began. And some of these trends are also true of families, along with additional disparities that are faced by households headed by single women. So here on this chart, the green bars represent estimates for all of New Hampshire households with a specific set of attributes, and the blue bars show the disparities for households headed by single women with those attributes. So families with younger children, lower levels of education, and those who rent their home all faced higher levels of poverty before the pandemic began. And these data show that families headed by single women with those attributes, or with any attribute, faced substantially higher poverty rates regardless of other factors. So given these impacts, or given what we know, we can look into some of the resulting impacts of these employment challenges in New Hampshire. So to measure this, we can turn to estimates provided by the Household Pulse Survey. Now, this survey is conducted by the US Census Bureau either weekly or bi-weekly, depending on the time period. And its goal is to help improve understanding of some of the household level effects of the pandemic. So some of its findings and some of the estimates show that nearly half of New Hampshire adults reported a loss of household employment income between March and July of 2020. At the end of 2020, about 1 in 4 households expected future employment income losses, and about 1 in 3 reported difficulty paying their usual household expenses. And from April 2020 to March 2021, between 4 and 12% of households indicated that there was either sometimes or often not enough to eat in the last 7 days. So in terms of estimates for just the difficulty in covering household expenses generally in New Hampshire, which includes expenses for housing, food, insurance, or anything else that's considered a usual household expense, this chart shows that from August 2020 to March 2021, between 1 in 5 and 1 in 3 households in the state had found it somewhat or very difficult to afford their usual household expenses, and that's in the last 7 days. And that tapered off a bit in the most recent estimates in April 2021. And additionally, we can see how the recent federal aid packages that included the direct economic aid for many households interacted with some of the challenges that these households were facing. So we can see that, and we can see that based on the declines in the reported difficulties in covering household expenses after the enactments of the coronavirus Response and Relief Supplemental Appropriations Act from late 2020 and early 2021, and the American Rescue Plan Act from that was enacted more recently. So in summary, there are several key points to remember. So the COVID-19 crisis resulted in the most acute employment losses among workers earning lower wages and in certain service-based industries. And many of the top-line indicators have improved, like unemployment, but that may not be indicative of the recovery reaching everyone. And many individuals have left the labor force and could face underemployment or long-term unemployment, most notably women, especially women with younger children or childcare duties. And the data shows disproportionate impacts on certain groups, such as women and certain racial and ethnic minority groups. And there may be lingering impacts to regions, industries, and people that may require additional targeted aid and support to help ensure that the recovery is inclusive and equitable. And with that, I'd like to invite up Phil Sletten, Senior Policy Analyst, to discuss the American Rescue Plan Act. So Phil.
Thank you very much, Michael. I really appreciate it. I'd like to talk to you all today, and thank you for your time this afternoon. I'd like to talk to you all today about the American Rescue Plan Act and what it means for New Hampshire, or what we know at this point it has already meant and may mean for New Hampshire. As a reminder, the American Rescue Plan Act was signed into law on March 11th, 2021. There were several key 60-day deadlines for federal agencies to provide guidance and insight into specific policies and allocations. So we've actually learned quite a bit about the details of the American Rescue Plan Act in the last 2 weeks. So for the purposes of this presentation, I'll summarize the aid provided by the American Rescue Plan Act in 3 categories. First is aid to individuals and families. Second is aid to non-governmental and nonprofit organizations. And third, aid to governments. We'll start with the aid to individuals and families, and this includes direct aid coming from the federal government to households. And one of the key forms that we'll talk about for a little bit here is the child tax credit, which was expanded just for 2021 under the American Rescue Plan Act. And it's a very significant expansion. The maximum amount of the child tax credit was increased from $2,000 to $3,000 for eligible children in households that are aged 6 to 16 years old. And then for a child aged 5 years or less, the maximum amount went to $3,600. And the child tax credit was also expanded to include children who are turning 17 during 2021, who usually receive a much reduced related credit. You can see in the bar chart on the right how significant that 2021 expansion is in orange relative to the amounts that we see for eligible children otherwise under previous law. Another key component of this is that the benefit is fully refundable, meaning that even if a household has little or no income tax liability, they can receive the full amount of the child tax credit, including through refundable payments or through payments as tax refunds. So previously, you can see in the bar chart, the blue portions were the entire amount that was fully refundable. That was up to $1,400 for an eligible child. Now, for a young child, for example, for a child 5 years old and younger, that's up to $3,600 is fully refundable. Again, just for 2021. The payments are also going to be distributed differently as opposed to a full sort of lump sum credit after taxes have been filed. Now they will be paid in installments, again, just in the second half of 2021 from July to December. And depending on the frequency of those installments, that could be several $100s per month for an eligible child. And the expanded benefits do phase out for higher income households. So what does this mean in terms of benefits to children in New Hampshire? The Center on Budget and Policy Priorities estimated shortly after the American Rescue Plan Act passed that a total of 222,000 children in New Hampshire, which is about 87% of all children in New Hampshire, would likely benefit from the expanded child tax credit. Specifically, the Center on Budget and Policy Priorities estimated that about 8,000 children in New Hampshire would be lifted out of poverty. And that's compared to a total of approximately 18,000 children who are estimated to be in poverty in 2019 prior to the pandemic. And this expanded child tax credit is a key component of the American Rescue Plan Act's efforts to reduce child poverty. There are 2 separate estimates, one from Columbia University and one from the Urban Institute, that both calculated that child poverty would be roughly cut in half by the American Rescue Plan Act, and the lion's share of that work, if you will, is done by this expanded child tax credit. So it's a really significant change. And as a reminder, when we're talking about children in poverty in New Hampshire, it does vary by geography, it varies by household composition, it also varies by race and ethnicity. So for example, about 1 in 12 non-Hispanic white children were in poverty during the 2015 to 2019 period. And an estimated more than 1 in 5 children identifying as Hispanic, Latino, Black, or African American were in poverty in New Hampshire. And of course, this is just talking about who's in poverty. There are many other children whose households do not fall below the poverty line, but are still near to that point. One way to measure that is about 1 in 4 children enrolled in New Hampshire public schools were immediately prior to the pandemic eligible for the federal free and reduced price school meal programs. And that mostly includes children whose households have incomes less than 185% of the federal poverty guidelines. So again, about 1 in 4 children enrolled in New Hampshire schools prior to the pandemic were at those income levels. So There's other aid as well that goes directly to households from the American Rescue Plan Act. There are the economic impact payments, the $1,400 checks on a per person basis that went to low and moderate income households. The earned income tax credit has been expanded for 2021, again, just 2021, to include certain adults who were not age eligible or adults who, depending on the composition of dependents in their household, may not have received as large a credit. Now the credit will be larger for those households. The federal government also extended unemployment compensation eligibility from the prior established policy in previous federal aid packages. So including more people to be eligible and boosting the benefit here in the American Rescue Plan Act, the benefit was boosted $300 per week through the beginning of September. Again, that's what the federal government is providing. States, including New Hampshire, have made processes to have different timelines and different decisions around that. The Supplemental Nutrition Assistance Program, which is known as the Food Stamp Program in New Hampshire, has seen a benefits increase. It saw that in the December aid package. That's continued by the American Rescue Plan Act of 15% boost in total. This is also, the SNAP benefits are found to be really effective economic stimulus as well, especially during weak economic times. There's enhanced subsidies for health insurance for people who are shopping for health insurance on the individual marketplace. Depending on the income and composition of the household, this could be the equivalent of hundreds of dollars a month in benefits. So a really significant piece for folks who are on the individual marketplace. There's emergency rental assistance, and that this $152 million coming to New Hampshire from the American Rescue Plan Act is emergency rental assistance that that follows the $200 million allocated in the December aid package. And again, it's designed to help people pay rent and keep them in their homes. And then the Child Care and Development Funds, which total about $30 million to New Hampshire from the American Rescue Plan Act. Those are designed to help people with low incomes and have families with essential workers access childcare. That's really what the purpose of that allocation is. Now, moving to aid to non-governmental organizations, but staying with childcare, there are childcare stabilization grants that go to childcare centers that had less revenue and higher costs during the pandemic. That's about $48 million in funds. There's also funds to higher education institutions in New Hampshire, both public and private. The estimate that I've seen is about $165 million to schools in New Hampshire. And roughly half of that has to be focused on providing assistance to students to cover their costs. So whether that's food, whether that's housing, that would be aid directly to students to help them. There's also assistance to non-public, generally K through 12 schools as well, and aid to health centers. These are generally community health centers funded through the U.S. Health Resources and Services Administration. That aid is in several different revenue streams for several different purposes for those health centers. The Paycheck Protection Program was expanded to some organizations that previously weren't eligible, including certain associations. There's tax credits for smaller employers who are incurring costs associated with providing paid sick and family medical leave to their employees. So there's a tax credit that's been extended for those costs. And then there's aid focused to restaurants and closed venues as well in particular. Now, there's a significant amount of aid flowing to governments in New Hampshire in particular from the American Rescue Plan Act. So talking particularly about those New Hampshire aid, about $350 million is going to public K through 12 school districts in New Hampshire. And that's designed to help with the costs associated with reopening and reopening safely, but also addressing pandemic learning loss. So lost learning time that happened during the pandemic. Really, some of those dollars are dedicated to address that. There's also a one-time boost for one-time purposes to the Temporary Assistance for Needy Families block grant that the state receives from the federal government. There's also a boost to home and community-based services through the federal Medicaid program. Those dollars cannot be used to supplant previously or identified state funds. They can't be used to offset state funds and reduce state costs. They have to be used in addition to the state's appropriations. And there's a capital projects fund. We don't have as much detail about that at this point, but a lot of language focuses on broadband investments, as well as other capital assets that are important to communities. There's a small business credit initiative as well. And there's the coronavirus state and local fiscal recovery funds totaling about $1.457 billion coming to the state and local governments in New Hampshire. So let's talk a little bit more about that last line, because as you can see, it's a significant number. I should note that these dollars are not arriving all at once. There's 2 tranches that are coming to both the state and to local governments. And the first one should be arriving, or is arriving about now, and the second one should be arriving a year later, a year from whatever receipt date the federal government distributed the first round. So the state, as you can see, is appropriated close to $1 billion, about 2/3 of this total amount of aid from the state and local fiscal recovery funds. Counties will receive more than $250 million, and then cities and towns are close to $200 million in aid. So what can this aid be used for? Well, the U.S. Treasury Department has outlined both what are the permitted uses and what are some examples of those uses. This slide is nowhere near comprehensive in terms of the amount of guidance and permitted uses that are provided, but we've tried to summarize it here for you. Basically, there is considerable flexibility as to the aid that, as to how this aid can be used. And one of the things the Treasury Department urges is community engagement as to how these funds could be best deployed. These funds can be used to support pandemic response, so it's medical testing, tracing, et cetera. The Treasury Department indicates these should be used to fund vital public services and the public sector jobs that support those services. And they can be used to address health disparities that have been exacerbated by the pandemic and places where we've seen increased need, particularly behavioral and mental health services and assistance for substance misuse. There's also, the Treasury Department has indicated that responding to the economic impacts is something that's identified as a permitted example use as well, in particular aid to workers, households, families, small businesses, nonprofits, and impacted industries, with travel and tourism identified as an impacted industry. The Treasury Department also indicated that outreach and helping people access services is a key part of this as well. And that's important, especially when we consider that a lot of these services people may not be used to being eligible for or have access to, or don't know how to access. There are also there's temporary assistance that people may, even if they've accessed other services before, may not know how to access these temporarily available services. Premium pay for essential workers is permitted, as well as particularly retrospective pay. So this is pay provided for work done during what we hope was the height of the pandemic. That's something the Treasury Department has permitted these funds to be used for as well. Certain housing services can be paid for, not all housing services or not all housing related activities, although the uses do expand in areas particularly with low incomes. And lead paint remediation is one of the identified housing services that these dollars can be used for. Broadband infrastructure, there's a fair bit about broadband in the American Rescue Plan Act, and a wide array of water and sewer infrastructure can also be funded with these flexible dollars. And really, the Treasury Department's indicated that these dollars, some of the uses they'd like to see of these dollars, if you will, are helping those who've been most impacted by the pandemic and fostering long-term beneficial health and economic outcomes. And the ways that these dollars can be deployed to do that would be to address some of the systemic health and economic challenges that have caused the unequal impacts associated with the pandemic. Now, while these funds are very flexible, there are some prohibitions and limitations on what they can be used for. They cannot be used by states to directly or indirectly fund offsets to net state tax revenue reductions that are a result of policy changes. So the language in the statute didn't provide us with as much clarity as, for example, the guidance has now. The way that this provision will work is that state fiscal year 2019 will be used as a base year, and there'll be an inflation adjustment going forward from that. So any reductions in revenue that don't fall below that baseline, that inflation adjusted baseline based on state fiscal year 2019, would not run afoul of this provision. They would not count as those net state tax revenue reductions relative to that baseline. Ones that do fall below that baseline would have to be specifically offset by either other tax increases or expenditure reductions in departments that do not receive aid from the American Rescue Plan Act flexible funds in another way. Those funds would have to be specifically identified to not lose federal assistance as a result of tax reductions because of this provision. Now, these funds can also not be used to be deposited into pension funds or to rainy day funds. They can't be used to increase the unemployment compensation fund to beyond pre-pandemic levels. They can't be used to pay principal or interest on existing debt, and they can't be used to match other federal funds. So, for example, they can't be used to supplant state expenditures that match federal Medicaid dollars, for example. They generally can't be used to support pandemic-related expenses by governments from before March 3rd of this year, and they generally can't be used for more general or non-pandemic specific economic or workforce development. However, there are caveats to that associated with, particularly with low-income or areas. And the costs must be incurred and obligated by the end of 2024. The Treasury Department did recognize that some of these expenditures, especially the capital ones, may take a fair bit of time. So the actual expenses have to be wrapped up by 2026. So the American Rescue Plan Act provides significant funds nationwide, but in particular for the purposes here to New Hampshire for targeted investments for assistance to individuals and really a focus on recovery rather than relief. And this is as opposed to the relief from the pandemic that we saw back in 2020. This is really focused on sort of both the short-term and the longer-term recovery, setting us up for a more successful economic recovery. The total assistance flowing to New Hampshire is likely totaling several $1 billion. The initial estimates that were available for statewide by state provisions suggested it was close to $4 billion, but those estimates didn't even include all the provisions in the program. So it's likely to be significantly more than that. About $1.5 billion, again, is going to state and local governments in New Hampshire for a wide variety of uses, but primarily those focused on the economic and health impacts of the pandemic. And many of the provisions of this act are time limited, including both that flexible assistance to governments and assistance to individuals. And the Treasury Department, again, provided lots of examples and lots of guidance as to how these funds could be used, but they encouraged recipients to consider funding uses that foster a strong, inclusive, and equitable recovery, especially uses with long-term benefits for health and economic outcomes. And with that, I'd like to pass the microphone to Anne-Marie to introduce our panelists.
Thank you, Phil. And thank you, Michael, as well, for providing a foundation for our audience regarding the impacts of the COVID-19 crisis here in New Hampshire and the details regarding the American Rescue Plan Act federal aid to New Hampshire. This federal aid can be used over the next several years to help spur an equitable and inclusive recovery that reaches all Granite Staters. It is now my pleasure to introduce our guest speakers for today's panel. And before we start, I'm just going to change the view so that everyone can see them. Okay, so Katie Easterly-Marte is the Executive Director of the New Hampshire Community Development Finance Authority. Katie has been with CDFA since 2011 and previously served as the Chief Program Officer before her appointment as Executive Director in 2017. Prior to joining CDFA, Katie had more than 10 years of experience in community development, including affordable housing development, as well as neighborhood planning and revitalization. Katie has extensive experience bringing together local, state, and federal resources that can leverage additional investments to communities. Will Arvello is the Director of the Division of Economic Development for the State of New Hampshire's Department of Business and Economic Affairs. In this role, Will works with a team that focuses on statewide issues related to economic development and strategy, business recruitment, expansion and retention, workforce training and development, and diversity and inclusion. Prior to his appointment, Will served 33 years in leadership positions within higher education at public and private colleges, including 10 years as president of Great Bay Community College. Carrie Gladstone serves as the Senior Director of Asset Building Strategies at Granite United Way. Carrie has been involved with helping working families for more than 25 years, including youth employment, welfare to work, and assisting would-be entrepreneurs to start or grow small businesses. In his current work, Carrie oversees financial empowerment and free tax preparation services for an area covering most of New Hampshire and Windsor County, Vermont. Carrie also chairs the Creating Assets, Savings, and Hope Coalition of New Hampshire, also known as the CASH Coalition, and the Emergency Food and Shelter State Set-Aside Committee. Thank you all for lending your expertise and insights to this panel discussion. I'd also like to welcome NHFPI Senior Policy Analyst Phil Sletten to join us once again on screen to moderate the panel discussion and facilitate the audience Q&A. As a reminder for those in the audience, please continue to post your questions using the Q&A function located at the bottom of the screen. We'll do our best to answer as many questions as possible in the allotted time. And now I'd like to turn this back over to Phil to moderate our panel discussion.
Great. Thank you very much, Anne-Marie, and thank you to the panelists for joining us this afternoon. We really appreciate it and look forward to hearing more of your insights and thoughts. So one thing that I wanted to start with, that we are in a very dynamic environment right now, given the uneven impacts of the COVID-19 crisis and the recovery thus far. Reflecting on the data that was just presented, what are some of the key points that stand out to you, and what are the areas that you or your organization is most focused on relative to this crisis? And I'm going to start with Carrie, if you would.
Well, thank you to the Fiscal Policy Institute. Phil, you always do a great job. Thank you, Anne-Marie. Michael, you did a wonderful job presenting as well. And I am struck by a couple of the statistics that Michael presented, specifically with reference to poverty, that the child poverty rate seems to be more pervasive. If you looked at some of the ways that the family structures were broken down in that one slide, you saw that families with children have a higher poverty rate than the general population in New Hampshire. In addition, noting the issues affecting Black, Indigenous, and people of color, that Black and African American people identify as having twice the poverty rate as white people in New Hampshire. So there's a lot there. My own work at Granite United Way, as was mentioned, is focused on our volunteer income tax assistance program to help people claim some of the tax credits that you described, Phil, as well as an overall means toward financial stability. The economic impact payments, the stimulus payments, as everyone but the IRS called them, and Phil as well, were to try to help people along the way. There were a number of people who did not claim those credits for a variety of the benefits for a variety of reasons. And the IRS said that even if you did not have a tax filing responsibility, you could file a return and get that stimulus payment as well. We're very proud of the fact that statewide, our VITA program in New Hampshire helped people claim $500 million in stimulus payments in the tax season just ended a couple of days ago that they might not otherwise have gotten. I do want to talk a little bit more about the couple of developments in the child tax credit and the earned income credit, as you described, Phil. You did a very nice job with the child tax credit, so I won't go into further detail. But to point out that it says across the country, it could cut poverty in half among children. And similar, I think the figure that you presented, about 44% of children who are now living in poverty would be raised out of that rate by the data that was presented. The earned income credit has a particular benefit for people who do not have a child to claim, and it benefits older workers, 65 and above, who are staying in the workforce, particularly because of a need for financial, just kind of keeping up with the bills. And this will provide an additional benefit that they weren't otherwise able to claim. For younger workers starting out who previously had to be as young as 25 to get the earned income credit, now as young as 19. Those who do not have a child can file a tax return, get that benefit in their early 20s. And that's been triple from the amount of the credit that it was previously. It also benefits non-custodial parents, folks who may not be able to claim their child, but can provide some assistance to their child, as well as having a little more in their pocket. Beyond that, Granite United Way is involved in a number of things that we're focused on. 211, the statewide information and referral helpline, run by Granite United Way and is taking calls on an extensive variety of topics, typically food and rent assistance, and that really blew up over the course of COVID-19. We're also operating the COVID-19 official state helpline. That's in addition to being the foreclosure intervention hotline and homeless hotline. And a lot of what we're hearing from the folks taking the calls at 211 is they're hearing from people who never called 211 before. They were never in that situation where they needed to access housing assistance, food assistance, and didn't know where to turn. So that was something that was that really struck me. Granite United Way is also the operator of 3 of the state's 13 public health networks. So that includes operating those big mass vaccination efforts at the New Hampshire Speedway and some others. So right now that focuses on shots, getting people vaccinated. And on the private side, we're joining with the federal government and saying, we have relaunched our COVID-19 relief fund, which last year saw some people being very generous to help their very vulnerable neighbors. And we were able to distribute about $1 million in assistance to those good folks.
Thank you, Carrie, and thank you for your work on all those fronts. I mean, there's obviously a lot. Again, it's a very dynamic environment, so there's a lot of people who are needing assistance that previously never needed it and had no idea how to access it. So that's great to hear. So thank you, Katie. I want to turn to you about what you saw in those data, what you're seeing in this crisis, and what you and your organization are focused on during this crisis.
Absolutely. Thank you so much, Phil. And I just want to also recognize the amazing information that you presented. Your data is always really helpful as we really strategize and set our priorities at CDFA. A couple of things that really struck me, and a few that Carrie mentioned as well, were the unemployment by industry. And we really saw that there's differences in those who are unemployed based on industry. And what we really see that, where we really see that is that our industries are often concentrated in areas of the state. And so while we saw that unemployment, we've also seen some pretty significant disparity in certain areas of our state, most notably in rural areas and areas that have been reliant on travel and tourism. And I also was really interested in, and we've really been seeing the impacts of for parents, particularly for single parents who rely on childcare and on stable housing in order to re-enter the workforce, and really showing through your data that those individuals were really impacted in a more profound way than others during this pandemic. And I think as we really look at CDFA to focus on a number of those issues, including housing, childcare, as well as creating new opportunities for people to gainfully be in employment and to start new businesses. Some of the information that really strikes us is the low vacancy rate. Across New Hampshire, the vacancy rate in New Hampshire is hovering at about 1.8%. We've seen throughout the pandemic that many people have actually come to New Hampshire, either relocated here or buying second homes here. One of the statistics that was presented recently by New Hampshire Housing, and it really struck us as having just such a bearing on low-income people, is that a person at 30% of the area median income has less than a percentage chance of being able to afford an apartment. And that's pretty much across the entire state of New Hampshire. And what's that resulting in is an increase in housing instability and homelessness. And Carrie really mentioned at 211 that they're hearing from people who are housing unstable for the first time. And that's what we're seeing in the data coming out of from our homeless providers as well, that the majority of people seeking shelter are actually people who are seeking shelter for the first time. And that's a new phenomenon because of the pandemic. And what that's resulted in for school-age children is the latest data suggests that there's more than 4,000 children who are actually unsheltered across New Hampshire. And as we know, where a family or an individual does not have housing stability, then recovery is much more difficult. So as we really think about sort of stabilization leading to recovery, that recovery we know is really only possible if there's a stable environment. And I think that happens with communities as well, as we really think about those industries and where the concentration of those industries are that has had the most instability in their businesses and their businesses' ability to retain workers. We've seen that our communities have not fared equally. We see that the growth of population, New Hampshire's seen modest growth in population, and that growth in population is not consistent. So there's some communities that are attracting new residents to their community, new businesses, and there's other communities that are losing population year after year. And really those communities with the most resources are able to attract businesses and people most successfully. And it becomes a perpetual cycle of being able to invest in your community and then continue to attract people to it. And that also is true for the capacity of nonprofits. Something that CDFA concentrates on is the collaboration between municipalities and nonprofits to put forward important community economic development projects. And we see those nonprofits that are either in rural communities or led by minority individuals, and really supporting those that have the most need are often have the least amount of resources. And one of the pieces of data that's been really interesting is to really look at that question of like, how does this impact someone in the long run? So we know that there's income, there's a variation in income in communities. There's different opportunities, community to community. But one of the really interesting pieces of information from the Opportunity in Atlas suggests that right in Nashua, if you live in one census tract, you're likely your average household income at age 35 is likely to be $28,000. And if you actually staying in Nashua, go to the next census tract over, that your average likely income at age 35 would be $42,000. So really just speaking to this idea of the inequity of opportunity, both for individuals who don't have that stability, and then in certain neighborhoods and or communities. And those are really things in terms of providing solutions that we're looking to, we continue to provide technical assistance and financial solutions for communities and nonprofit partnerships to build opportunities for individuals and create an economic pathway in their community.
Great, thank you, Katie. It's very interesting to hear how some of the items that you're looking at interact with both the different impacts, the disparate impacts that we've seen from this crisis, because unlike a usual recession where sort of everything slows down for everyone or for most folks, we've seen very different impacts depending on exactly what your specific situation is, and how that interacts as well with some of the long-term trends, some of the things that were pre-existing, such as the Opportunity Atlas data that you cited. So that's very interesting. So thank you for sharing. Will, I'd like to go to you to ask you about what you saw in these data, and what were some of the things that struck you, and what you and your work is focused on with regard to the crisis. Oh, Will, you were still muted. I'm sorry.
Thank you, Phil. My initial reaction to the data is kind of to Carrie's point, and to carry on with what Katie said is, I'm familiar with a lot of the data. This is not a huge surprise to me in terms of poverty levels and so on and so forth. We know that that's happening both in the state and it's happening nationally, and we need to find ways in which to mitigate those. The huge surprise to me is in terms of the inflow of ARP funding, and prior to that CARES funding, that has had an impact on specifically on child poverty. So if we take the funding and apply it to mitigating child poverty in the state, to by 50%. I mean, that's huge. I mean, that's incredible. And my kind of question about that is going, after the funding is done and over with, what's going to happen with that in terms of sustainability, in terms of keeping those children out of poverty? So, are we in a situation where we see children come out of poverty for a certain amount of time and then have them go back into poverty once those funds are used up? So that is kind of an observation that I saw. The other one, of course, is the huge influx of funding that's coming into the state, and how that's really, there is an opportunity to impact every sector of society in a positive way. But again, I think we not only have to look at this in the short term, but we have to look at it from a sustainability and resiliency perspective. So how do we use those funds, and how do we keep those levels of empowerment or levels of improvement in the sectors of the economy, families, communities, going beyond this funding cycle? So those are kind of just two observations. At Business and Economic Affairs, as we all know, is in the Department of the state. We're working very closely with the state on any number of issues from when the pandemic first started. We started to work with the state on making sure that businesses were getting the information and the resources that they needed to have in order to make sure that they could stay open and continue to sell their products and their services and so forth. And as we know, the economy was usually impacted, but I think as a state, we did a respectable job in terms of doing what we needed to do to put the processes in place to ensure that resources were flowing. In partnership with the Small Business Administration, in partnership with with FEMA and other federal agencies, and in partnership with agencies like Katie's Community Development Finance Authority and many other agencies and organizations at the local and regional level. So the one thing that I've seen come out of this in terms of the state working both with the federal government, working with the Congressional Caucus, working with local agencies and organizations, is that I'm starting to see more of a coming together of people who do work in similar areas, but in the past maybe were not working as collaboratively as possible. And I one of my criticisms is that, and of course it's not just relevant to New Hampshire, but it happens in just about everywhere, right? Is that we tend to gravitate towards silos. But we know that one of the things that the pandemic kind of showed and pointed out is that we can't continue to go down that path, that we have to, especially a state like New Hampshire that has relatively smaller resources than other states, that we have to find ways in which to collaborate and come together and so forth. And the one of the strategies that we're working on, so we're now in the midst of, we will almost be out there with a statewide strategy for economic development. That will be coming out soon. But the vision behind that strategy is that very thing, that we have to recognize that we're going to have healthy communities. And I think Katie spoke to some degree to this, that we have to think more holistically and more systematically about how those communities function. You know, everything from childcare to child poverty to transportation to housing to all the other things that healthcare that make that community vibrant. And so, and they're you know, all these things interact with each other. So how do we as a state, in terms of thinking about post-pandemic and recovery and resiliency, really work with those communities and those businesses in those communities, the nonprofits, to ensure that we are thinking more in a community mind, in a more holistic way, to address all those different areas that need addressing. Only then, I think, can we really focus on the long-term economic outcome, recovery, ensure that our children are, less of our children are living in poverty, and that they're getting the adequate education and all those kinds of things. So we're very busy, really, again, working with all these different entities to make sure that those resources flow to where they need to flow. And that's, so I'm, you know, while I have, obviously, I think some of us see the data and are concerned. I think if we work more collaboratively, work more together, that we will achieve some of these goals. And I think as a state, be in a better position in 5-10 years.
Great, thank you, Will. And I'm going to stick with you and stick with one of the points that you made, actually, and what you've observed, if I could, for the next question, which I'll ask all the panelists. What opportunities do you see to use these flexible funds to create a more equitable and inclusive economy as we recover from this crisis?
Yeah. I will start by saying that I've been in conversations with the commissioner about this very thing. And the commissioner is very concerned because we saw, as an example, when pandemic first started and the federal funds started to flow for businesses, one of the things we were seeing was that businesses in underserved and minority communities were not getting the flow of information and the services. So there was a gap there, and that's a gap that continues to exist. One of the commitments that we have made is that we have to figure out ways in which we can tap into those communities. So we have to build the platform or the infrastructure that will allow us to reach beyond the regular pipelines that we have evolved over time to get resources to whether it's businesses or communities. And we have to build this new pipeline or this new platform that will ensure that we get resources down to these underserved communities. And that to businesses, things like, for example, obviously digital equity kinds of things, broadband, childcare, all those things really, I think there's an opportunity here for us to utilize these funds to not just get funding to these communities, but also to build the mechanism through which more information and more resources flow. And again, organizations like Granite United Way and CDFA are a real strong integrated part of that process. But I think that there's opportunity to build what's already there.
Great, no, thank you. And I'll ask the same question to Katie. Building off that answer, I'll ask the same question to Katie around what are the ways, what are the opportunities that you see for use of these flexible funds to support an equitable and inclusive economy as we recover from this crisis?
Absolutely, thank you, Phil, and thank you, Will, for really providing a great backdrop for where we should be focusing. I think from our perspective, it really is those things that you mentioned, collaboration, partnerships, the real connection between private businesses, the public, and really using this public funding to be a catalyst for a people-focused approach and recovery. And I'll just provide a couple of examples, and there are so many more, but in terms of childcare, we've been fortunate to work with some really fantastic backbone organizations in communities, some of who have additional capacity. They also have additional responsibility right now in the pandemic, but like the federally qualified health centers, and those federally qualified health centers actually taking on a whole approach to a family and to an individual's health, and considering things like childcare being an area that they can actually provide additional capacity. And at CDFA, we're actually working with one of those organizations to expand affordable childcare spots to provide 60 new spots of childcare. And what has always been a struggle and will continue to be a struggle as we really can think about how to build back better, which has really been the focus, I think, of so many conversations at the federal level, at the state level, is how do we really build a system that is sustainable and that really provides opportunity for more people that had the opportunity before. And one idea is really working with these backbone or community organizations. So they'll provide additional childcare spots, and we know they have the infrastructure to be able to support a workforce and to be able to have that workforce be trained, well compensated. And so that's really an opportunity. But in that sort of people-focused, really listening to what community members are saying, and particularly those most impacted by the pandemic. We spoke about some of those populations that have most impacted. And one of the things that's really come out in some focus groups, actually with particularly non-white people in our state, is that it's very difficult to trust a system that has allowed you to have such more significant impacts of a health crisis than your white neighbor. And so how do we really think about what the needs are that are different and really be responsible to that. And so when we think of childcare, one of the interesting things that was presented to me was the fact that people may not be comfortable having their children attend a center, because that is farther away. Those children will now be farther away than they've been, not necessarily within the community that the person feels most comfortable in. And so there was actually another state in New England that has been advancing a program in which, as you receive workforce training and opportunities to really rethink your career, and are able to receive those workforce training opportunities, you're also provided a list of childcare providers, home-based childcare providers in your community that you can consider, and that slot's already been paid for throughout the time of your workforce training. So really bridging together the needs that people have so that we're thinking about that whole person and understanding that those people's, that all of our perspectives has changed, and we need to be listening to what people need, because we're very excited to be building on the backbones of, and those real amazing community organizations like the federally qualified health centers, but we also want to be building solutions in which that solution doesn't work for everybody, recognizing that and having options. And so we're really excited to be really thinking about strategies in areas like childcare and ensuring that we're listening to what is a people-focused approach, and that there's opportunities that meet individuals' needs, and that those are diverse in the opportunities available.
Thank you, Katie. And Carrie, I'm sure there are things you can build off of there as well. So what do you see as opportunities for this flexible funding's use in the recovery?
Well, Will and Katie both referred to a spirit of cooperation and trying to move forward in a collaborative way. That's a role that Granite United Way has played for years as a convener. We're looking at some of the opportunities to perhaps do some outreach to the folks most impacted in a positive way by what these flexible funds will provide, who are also some of our most vulnerable folks in the economy. So how do we educate them? How do we reach them where they live? What is that going to look like? So one of the opportunities that I see is through the Consumer Financial Protection Bureau, federal agency that sent out a request for communities to apply for technical assistance to help with building savings. And I think that's critical to all of this. I worked with a couple of other people, wrote the application, and Manchester was selected as one of 7 cities in the United States to receive some of this support. And it was focused on, some of the pictures that I saw early in the pandemic that really broke my heart was to see people lined up in cars waiting to get to food pantries a week into the pandemic. They had missed, one paycheck at best and were having trouble putting food on the table. So to be able to say, how can we work with the organizations that are already engaged? They may not be doing food insecurity work, but they're working with the same population. Federally qualified health centers, for example, is a great place to be working with. They have hundreds of patients that they see, often looking to have some ways that they can benefit the entire family. It's educating parents. It's taking care of the health of children. We're just starting to see it. The states and local governments only got the guidance last week. I know you've been all the way through it, Phil. I haven't read the whole 155-page document that is known as the interim final rule, which sounds to me like a contradiction in terms. But to say, we're going to be getting more and more specific guidance on what these funds can be used for and what they may not be used for, and we'll see how we can best put them to use for the benefit of our neighbors. Great,
thank you very much, Carrie. So I'm gonna go to audience questions now and try to direct them to the person who I think can answer them best. One is, or answer them best first, and please others do chime in. One is, and I think I'll send this to Katie first. What funding would you recommend for an employer interested in workforce housing in New Hampshire? For employers interested in workforce housing in New Hampshire, what resources are available?
Absolutely, thank you. I think so. Our partners at New Hampshire Housing help to support many organizations that are regionally or locally focused that really advance housing, workforce housing projects in communities. So I definitely start with New Hampshire Housing. I'd also, many communities have workforce housing coalitions, where coalitions of individuals, business owners, and nonprofits come together to support workforce housing. I would also say at CDFA, we both support capacity building of partnerships of businesses, community leaders, and nonprofits to advance complex projects through our tax credit program. So the tax credit program is a public-private partnership where nonprofits receive credits and then businesses actually support those projects by making a donation to the project and in turn receiving a tax credit on their business enterprise or business profit tax. So a business owner could work with a nonprofit in their local community and actually look to advance a workforce housing project and seek resources from CDFA and again from New Hampshire Housing as well to support that project.
Great. Does anyone else have anything to add on that question?
I'll just add to what Katie said that we know that through ARP, there can be significant funds that are going to be utilized, hopefully utilized for housing. We, as a state, to the points that Katie made earlier around housing, we recognize that we have two major problems, structural problems in the state right now, in addition to all the other ones that have been mentioned. But we have a workforce issue, and that's been going on for quite a number of years, and will continue to go on for quite a number of years because, as we know, we're not growing our own, so we're actually losing more people to death than that are being born. Despite the fact that we have a small number of people coming into the state over the last number of years. So the workforce issue is a major issue for us, and there are potential solutions that we're looking at, but that's a long-term challenge. But we cannot solve the workforce recruitment and retention issue until we solve the housing issue. And so the housing issues is core and central to everything. Many discussions around this, both in the legislature and organizations like Katie's. Probably Carrie's organization talks about this as well, but it's happening everywhere. And so the thing is, how do we utilize some of the funding in addition to the programs that CDFA and BFA and New Hampshire Housing can put in place to build additional housing stock, and not just one type of housing stock, because we need to have flexibility in different types of housing stock so we can accommodate single people and we can accommodate families and so forth. And we're probably under by about 25,000 units. You heard Katie say that the vacancy rate is under 2%, and 1% in some places. So both of those issues are crises for us, and will continue to be so. I think it's incumbent upon all of us as citizens, leaders in government and leaders in, again, agencies like CDFA and so forth, to really focus on that one issue, because until we solve the housing issue, we're gonna have problems with workforce. So it's gonna take time, and it's gonna take a massive investment.
And actually, there's another question that I'll stick with you, Will, for, if I could, is the question around the workforce development opportunities available to small businesses. You've already addressed it a little bit, but I'm curious if you could address in a broader context beyond housing. What are some of the opportunities available, or what do you see as a potential use for these flexible funds that could make it more available?
Yeah, so I think that the problem does not lie on the workforce development side, in terms of training and so forth. And we have the university system, the community colleges, we have the Centers for Technical Education. They all do a great job at being flexible and working with industry to train and so forth. The challenge is, no matter how much money we throw at it, we still don't have the people to put into the programs that will satisfy the needs of industry. And that's the $100,000 question or challenge that we have. And again, it's something that it's through the pandemic, as we knew, hospitality and tourism lost a huge number of employees, and those employees went to other sectors like manufacturing and healthcare and so forth. Your data point, Phil, indicated, or was it Mike, indicated that the hospitality and tourism industry are, traditionally kind of low on the low end of wages and salaries. So, and you have uneven hours, and there's a whole number of kind of challenges in those sectors. When people migrate to sectors like healthcare, manufacturing, where they have more traditional work hours, higher pay. So the challenge for a restaurant owner or for a lodging owner and so forth is how do you make your way back and get some of those employees back if they've migrated to other sectors, and there's nothing to replenish those individuals that have left. So every sector is hurting, but hospitality and tourism are hurting, more than others. So that's the challenge for us at the moment. And again, it's one that's going to be with us for some time.
Great, thank you. And I'm going to move to another question. And this one I'll have open for everyone. Oh, Katie, did you have something you wanted to add to the last question? Okay, I'll move to another question, and I'm going to open this for anyone who wants to pick it up, which is always the case, but I'll leave it explicitly open here. So there's so much state and federal data that speaks to the disproportionate impacts on women during the pandemic. What are the ideas and perspectives of all of you to make sure that these funds give women a comparable share of the opportunity and share in the recovery and not be further left behind in the workforce and the economy? And Katie, this reminded me of your one-time impacts versus long-term impacts question. So I'm curious, what are the thoughts that folks around the table have, the virtual table have here?
Phil, you mentioned in your breakdown of the flexible funds, the funding for child care and development funds, and I think that will be a very significant one. We've certainly heard, and it was pointed out, that women have been disproportionately affected by the employment side of this. And so while we have just heard the governor announce that there will be additional funding for people who, an incentive to go back to the workforce, to offset the argument that people who were receiving the enhanced unemployment benefits were choosing to stay home rather than go to work. We'll see if it was all economics, or is it the fact that finding suitable childcare is really something that disproportionately impacts women in the workforce trying to get back into the workforce. And that would be a very appropriate use of those funds with an eye toward the longer term.
Great, thank you, Harry.
I'm going to echo the need for childcare. I think that's fundamental in ensuring people have opportunity. I also think there's a need to really think long-term in terms of compensation and leadership opportunities for women. And thirdly, and I'd say probably most importantly, is really to think about how to build a vibrant, supportive community around families, and particularly to support women. I think what some people have realized through the pandemic is that the sort of slowing down and rethinking the prioritizations of their individual families may have made it more difficult to think about re-engaging in the workforce and being able to sort of keep pace with the expectations. And I think that there's some opportunities to really rethink how we think of communities and how we think of the community facilities in our community. I know that there's been some interesting studies done at the federal level around how we can use schools as community anchors so that people can go to a school and instead of that student being dismissed at 2:30 inconsistent with the workforce or the normal working hours, that there's actually opportunities for children to stay, and then for parents to, for instance, stay healthy and exercise, again, right in that same place. So how do we really rethink what we're rebuilding and ensure that it's not maybe as individualized as it previously was, but that really people are supported either. I know there was another question in the chat about isolation, and particularly for our elderly. And I think this real connection of individuals based in a community is something that we could reconsider and rebuild with this opportunity of these funds, so that the places we have are more supportive of whole people going forward.
And Phil, Katie mentioned earlier the Whole Family's Approach to Jobs initiative, which is a national initiative, but here in New Hampshire, there are two two things that are happening, and it's a partnership between the Department of Education and the Department of Health and Human Services, and it's a real focus on how to solve what's called the benefits cliff, which is the ability for somebody like a single parent who wants to work but is receiving public benefits and being penalized because they are going to be making a little bit more money than they would receiving public benefits, and therefore it's one of those situations that again penalizes the individual for wanting to improve themselves, and that's something that's been going on for decades, and it's something that is now beginning to get attention. So I think it would impact specifically female single parents, and the other piece to that is the Council on Thriving Children, which is connected to the whole family's approach to jobs and the benefits cliff. So there are some really good initiatives and programs that are kind of just over the last couple of years started to take off and really tackle these questions and find ways in which we can build policy and programming to make sure that women in poverty with children, or men for that matter, doesn't matter, that they're getting the resources they need to be able to get themselves out of poverty and take advantage of opportunities that are out there, whether it's education or building a business and so forth. So, and then there's things like the Endowment for Health Race and Equity series that's tackling a lot of these issues around economic development and racism and so forth. And then another example that I'll give you, just something that I started on my own, is building what we're now calling just the New Hampshire Minority Business Owners Coalition, which is made up of minority business owners in New Hampshire, to encourage them to continue to do what they're doing, to network, but also really interested in the minority-owned, female-owned businesses and how we can support them as a group. So that's just starting to take off. So this is by way of saying that there are a lot of different kinds of conversations, initiatives, collaborations going on in the state, which again, to me, New Hampshire is kind of in a unique place. And I don't know if Katie and Carrie agree with me on it, but there are just good conversations going on, good things going on. Where they lead, it'll be interesting to see in 5 to 10 years.
So I'm gonna ask the last audience question before I go to Anne-Marie for the final question, and I'm actually going to combine two here. And you've already addressed a little bit of it, Will. So feel free to refer to what you already spoke about. But I want to open it up to the group. So Will, you had spoken before about the lack of flow of resources and information about them. How is the lack of flow of resources? Has the lack of flow of resources always existed and now heightened because of the pandemic? And then if and when we are able to correct this flow, how do we ensure that it is maintained and remains in place for the next big thing? And I'll pair that question with another similar sort of long-term view question, which is, or the question starts with a statement: the federal government has made a major investment to reduce disparities in resources and opportunities in New Hampshire, while the state has persistently failed to address these disparities, particularly in education and housing. What must be done to ensure these federal investments overcome rather than perpetuate these disparities? So those are two quoted questions for you. I'm happy to open up to whoever would like to address those. Again, looking at how do we ensure that this investment lasts into the long term?
I'll start by saying that I don't know the history of how New Hampshire handled these things in the past. I know that in my time working for the state and through the pandemic, there has been a progression in conversations about addressing issues around childcare, poverty, children's poverty, and housing and workforce and so on and so forth. And again, bringing it back to what I mentioned earlier and what Katie spoke about is that this is, these things don't exist in silos, that we have to start to tackle them. And I think this is part of the answer to the question, that we have to start to think about these things in a systematic fashion and way, because everything's connected to each other. So again, if we don't have housing, we have displacement. If we have displacement, that impacts health and education and all the other things. So I think that and I may be, naive on this. What I'm starting to see is that again, there's more conversation at the state level amongst state agencies and organizations like Carrie's and like Katie's and others to really figure out ways in which we can work together collaboratively to utilize the resources more effectively and productively to tackle the challenges that we're facing as a state. And again, this is not going to be solved overnight. This is the state. We're a small state, but we're still a big ship in a sense. If you think about moving policy and legislation and those kinds of things. So the housing piece is one that's a major challenge for us, as we know, because the one thing that nobody's talked about yet is municipalities and local control and how that impacts anything related to legislation around housing and policy and so forth. And so we could have investors and developers that are interested in developing workforce housing, but if they're going to confront on the local level zoning kinds of challenges, and they have to spend hundreds of thousands of dollars sometimes to get to where they need to be in terms of developing housing, that's a major disincentive to anybody who wants to develop workforce housing. So it's a complex issue. There are a lot of people trying to tackle it. Hopefully, it gets solved at some point, because again, we can't move forward as a state. I mean, we've had a pretty hot economy coming into the pandemic, and I think we're going to come out of it fine. But if we're going to continue to thrive, we need to solve some of these things, and housing, childcare are two examples.
Great, thank you, Will. And Carrie and Katie, I want to give you both an opportunity to respond to the question as well.
I will quote the guru of affordable housing in New Hampshire, Dean Kristen from the New Hampshire Housing Finance Authority, who said the answer to to the housing issue is build more of it. Now, that's the answer. It's certainly a lot more complicated to get there. So I'll stick in, my lane of saying, how can we help individuals become more financially stable? I talked about the earned income tax credit earlier. In terms of a flow of resources, a quarter of the people in New Hampshire eligible for the earned income credit do not claim it. And that's before this additional change that brings even more people into eligibility for it. So to help those people claim the credit, which acts as a guardrail against the benefits cliff. It's money that can be added to their overall household income and is actually a work incentive. So it's one piece toward helping people have more income and become more financially stable.
Great, thank you, Carrie. And Katie, if you have anything to add on that last audience question.
I think fundamentally we need to bring new ideas into the solutions. And with an expansion of who's creating solutions, I think we will maybe create an opportunity for more capacity to use federal resources, and then hopefully ideas about sustainability. So I think there were some great ideas, specific ideas raised by my other panelists, but I think just this idea, there's been some experiments done by this organization called Strong Towns. And when a community has made a commitment to being idea friendly, to allowing something to be tried, even if it's not put in long-term policy, but just allowing individuals to raise ideas and have those ideas be tried, that the solutions of those ideas are systematic and they're sustainable and they meet the needs of people. And so I guess for things to really move in that direction of ensuring federal resources flow in a way that is making the impacts that we've all talked about wanting to see, and that is reflective in the audience questions. I think we need to really think about how we can be idea friendly and ensure that more people are part of the discussion and part of the solutions.
And maybe these federal resources are enable more creativity around those ideas because there's less of a resource constraint with these flexible federal funds available. Right. Thank you to the three of you. And I'd like to turn it back to Anne-Marie to ask the last question of the panel.
Thank you, Phil, for facilitating the panel discussion and the audience Q&A. Excellent job as always. So as we prepare to conclude today's program, I have one final question to pose to our panelists. This is very forward-focused the vision question. So these substantial federal aid dollars coming to the state create an opportunity to create an inclusive, equitable, and sustainable economic recovery that reaches all Granite Staters. So looking forward, what changes do you hope to see here in New Hampshire by 2025 and beyond as a result of these efforts and investments? So I'd like to start with Carrie, then go to Will, and then Katie first.
Well, I appreciate that a lot of the discussion has been about the folks who are least served by a strong economy. So I guess my greatest hope is that by 2025, essential workers will actually be looked upon as essential in our society. And thinking about things like the child tax credit, which benefits working people, if these changes that are proposed will have the child poverty rate for this 1 year, that's a game changer. If those changes are made permanent, it's a life changer. Beyond that, my crystal ball isn't crystal clear, but I'm looking forward to a time when we will see that perhaps if we have our neighbors in mind in the most helpful way, that it's beneficial to us all.
Thank you. Will?
Yeah, just like we are working with businesses and nonprofits to make them more resilient post-pandemic, and we're doing that through a variety of ways. That I would love for us to also think about how do we make communities and families more resilient, so that if we have another type of event like we had this past year, that we will all, from the family unit through community, through businesses, through state government, we will all be more resilient and come out of it quicker and even more resilient then. So for me, it is about in 5 years, how have we utilized this largesse from the federal government to implement policy programs that do help us think, come together, collaborate, think more systemically, and kind of have the voices of those I think that both Carrie and Katie referred to it a number of times, have the voices of the folks in those communities that really have been forgotten and not gotten the services, the information, that they are part of that process. Because only then, I think, do we really begin to make some headway in terms of outcomes indicators of progress in our economy. We have to strive to being inclusive, all inclusive in our economy, and that's the one piece that I would be hopeful to see. And we haven't even talked about the transition coming in terms of technology, in the workforce, and that's something that's coming down the pike. And so how that's going to impact working families and with the hope that you'll have higher wages and so forth and more opportunity. So that's yet to be seen, but that's another thing that is kind of out there that we need to be looking at as well. In terms, the great thing about New Hampshire, I always say New Hampshire is a great place. It's got a lot of wonderful things going for it. But one of the wonderful things it has going for it is that it has a very diverse economy. And so we're not a one-trick pony. We have a lot of different sectors. If one is down, another one may be up. So there's a balance there. And I think that sets us up for success, resiliency in the future. But we have to ensure that that success and resiliency reaches every part of our state and every community within our state.
That's great. Thank you so much, Will. Katie?
Yeah, I so agree with everything that Carrie and Will said, and hope that that's what we see in 2025, inclusive communities in which things that have worked in 2021 for recovery and support are put into place as long-term solutions for families. And Phil has taught me so much, and everyone at the fiscal policy has. And one of the things that I'd love to see is around an index called the Gini index. So the Gini index establishes the differences between those who are making the least and those who are making the most, and really indicates whether there's growing or shrinking inequity. And we've seen, particularly in New Hampshire, a steady rise in inequity. And in 2025, I'd love to see that we're on the downward trend of that growth in inequity, and that we have communities that are vibrant and more equal and meeting the needs of all of our fellow citizens. So
that's great. Thank you. Thank you so much, Katie, Will, and Carrie. Thank you for your insights. Great conversation today. I wish we had more time, but I'm sure our audience is suffering Zoom fatigue. So thank each of you in the audience as well for taking the time to join us. We hope today's presentation and discussion helped you to better understand how the COVID-19 crisis has impacted the state economy and the economic security in the Granite State, and how we can use the coming federal aid to foster an inclusive, equitable, and sustainable economic recovery. For the past year, NHFPI has provided insight and analysis regarding the impacts of the COVID-19 crisis on the Granite State, including the impacts on low-income families and the disproportionate impacts on residents of color and on our state's most vulnerable residents. With the addition of this federal aid, New Hampshire has the opportunity to foster an economic recovery that is both equitable and inclusive, and that reaches all Granite Staters. In addition to this federal aid, our next state budget is an important fiscal policy tool through which we can direct public resources to address long-standing needs and support New Hampshire's residents and economy. The state budget will span the next 2 years during a critical time in the economic recovery. This coming federal aid enables us to look out even further, providing funding that can be extended through 2024, enabling us to provide sustained support when and where it is needed most. The key will be targeting aid to children, families, and communities where the needs are greatest, to ensure an equitable and inclusive recovery that is also sustainable and that reaches all Granite Staters. NHFPI will continue to provide new resources related to the economic recovery, the state budget process, and other topics of concern to the state. You'll find all NHFPI publications and resources available at our website at nhfpi.org. We hope you found today's presentation to be helpful. I'd once again like to thank our guest panelists and NHFPI staff as well for your great insights today. The presentation slides and link of the recording from today's event will be posted to our website, and we'll be sharing all of them with all of you via email later this afternoon. So thank you again for joining us today. Please stay safe and well, and enjoy the rest of your day. Thank you.